Well, tonight we are looking at the impact of free medical services on healthcare, and as you've seen there from the report with Judy Koske, the problem really may not be rather the free maternal healthcare is not the issue as such, rather the accessibility. As you've seen there, wheelbarrow ambulances being used in Kibera there, meaning that there is a problem with regard to accessing these health centers. And tonight we're asking you, is the government's waiver of maternity fees a priority, or should underlying constraints first be addressed? Is the government's waiver of maternity fees a priority, or should underlying constraints first be addressed? Our SMS number is 2442. And with me in studio tonight, I have Dr. Ann Kihara. Thank you so much for joining us tonight. She's the chairperson, Kenya Obstetrics and Gynecologist Society, and Dr. Victor Ng'anyi, chairman, Kenya Medical Practitioners, Pharmacists and Dentists Union. Thank you very much for your time, lady and gentlemen. I'll start with you, Dr. Kihara. When we talk about access, what are we accessing? And in this case, what does access mean?
I look at access slightly differently, because it's not just the physical access to a facility. You need to have human resource. You need to have that particular facility well stocked up in terms of supplies and equipment. You need to have aspects of trained personnel within that facility to provide services. You also need to have access to knowing in that facility the documentation that will actually guide you into, are you giving appropriateness of care, and what planning can you do as far as financial resource allocation is concerned. Yes.
Dr. Victor, are most people within reach of a health facility? As you've seen from the feature that we've just aired for you there, the problem here really is not regarding the fee as such. People may be able to get to these health centers, but when you're in pain, when there's an emergency situation, how do you get to these health centers?
Well,
when you're in far-flung areas?
I can tell you, for me, access means access to a facility that is of sufficient quality to conduct a safe delivery, and that's safe both the mother and the baby. And we have ideals that we're aiming for. I can tell you that in fact, in this country today, there are people who have to travel 80 kilometers to the nearest health facilities. There are people who will live their lives from birth through death, having gone to hospitals and never see a doctor in this country because they have such grave shortages in our facilities. Access is a big issue. And when you have to be referred, when you know when the nearest hospital is, maybe it's 30 kilometers away, you need transportation that is safe for you, ideal an ambulance. That doesn't exist. You don't have enough personnel to man these kinds of facilities. But I'll answer directly the question that has been asked. Is free maternal health care a priority at this stage? And whereas there are challenges, I have to say it's a good thing that we need to support, and we have to see it working. The challenge is it's adding extra pressure on a public system that is already congested. And
we'll be talking about the congestion of the public system. Let me talk to you, Dr. Kihara. Yes. Maternal care means care from conception all the way to delivery, but the ruling coalition does not clearly outline what free maternal care entails. Does this mean that the lady will get prenatal care, postnatal care? What exactly are we looking at here? Because there's likely to be a bit of confusion regarding what exactly this free maternal care entails.
I want to believe once a woman is pregnant, up until the time her physiology goes back to the norm outside the pregnant state, which would then mean she'll be followed through the antenatal, she will be given childbirth, and she should be followed ideally up to the 6th week, which we call the postpartum period. And that's the period in which her body now returns back to what we consider normal physiologically. Yes.
And you had just touched on the fact that our systems are really congested as of now. Are there sufficient resources to conduct successful deliveries? And we're not just talking about maternal health care here. We're just looking at the health sector in this country right now. The resources, we know that in certain areas you will go to a health center and you will be asked to come with your own cotton wool, your own spirit, with your own gloves if surgery is required. Are there sufficient resources?
Health center, this has even happened in referral hospitals. And I think at some point you noted my hospital was closed, they didn't have gloves, you need to come with your own gloves. That is the story of our facilities. Every day, patients are sent out to go and buy drugs to come and treat their relatives. Of course, the richer patients do better, the poorer ones do worse. Why is this? We only allocate 2 billion shillings to drugs and medical supplies versus a requirement of 15.94 billion. We have a dependency ratio on donors of up to 95% on our TB program, HIV program, malaria program. We need to have our own sustainable solutions, and they're not out of reach. They're within reach. It starts with policy. I think Dr. Kiara mentioned this when we're still speaking. Let's start the conversation, but then the policy makers must come in and make policies that are in line with healthcare. That is why I particularly support the idea of giving free healthcare, because whereas it strains the resources, there are people who never come to hospital because they're so poor they can't afford the 20 shillings, the 7,000 shillings. And for that group, this is big relief. For a chain, they have a chance to go to hospital. What we need to do is, even as we give the free, now we have to work towards ensuring this doesn't go the free primary education way. We have to bring in the health workers, and by bringing them in, we pay them better to ensure that they stay in public institutions. We allocate drugs, and then we build the facilities and equip them appropriately. That is the whole
Indeed,
package.
it cannot go the free primary education way, because this is a matter of life and death.
Absolutely.
Yes.
Yes.
I would add on, because this is the Kenyan society we're talking about. So the quality of the society that we are having will basically depend on goodwill, especially politically. I think it will start by investing in health. And ideally, as per the Alma Ata, we're at about 6% of the Kenyan revenue allocated to health. We should be at 15. Doubling it alone, I believe, would make much of a difference as to what kind of outcomes and what kind of stocking of facilities would happen.
And I'll just take you back to that feature, Dr. The fact that there are wheelbarrow ambulances already really a cause for alarm in this country. Not so much a cause for alarm, but is an indicator that there is a problem. Ambulances right now, unless really you have insurance cover, unless you have medical cover, if you're in the rural area, if you're in a village in Machakos, in Kiambu, in Kilgoris, out there really, and you have no medical cover, will you really be able to call an ambulance and expect them to come to you? Which brings me to the issue of the traditional birth attendants and the midwives and the conflict therein. What is the stand on that?
I'll start with the ambulance issue. I think Kenyans are very innovative. And when you realize that even somewhere like Kibera, you don't have the access roads, I would say that's kudos to them, because at least they're trying to do something to make it better for that woman in need. We use ambulances, we use taxis, we use the borders as alternative means. But ideally, and especially now with the decentralization, hopefully, of healthcare, it should be a priority zero, that we have fully equipped ambulances allocated, at least to the county level. And if better still, even within the counties, you have the far-fetched areas or the marginalized areas being accessed using an ambulance.
You know, Muli, the problem is that healthcare, as much as it tells you, you see wheelbarrow ambulances, it looks tragic. It's never really tragic to the people who matter. Look, we have more than 7,900 mothers dying every single year. That's a tragedy, you know, because pregnancy is not even a disease. But nobody seems to take note. Children who die during birth or within 28 days during birth, that's related to maternal care, the quality of maternal care. We lose about 42,000 every year. That's 112.
Yes,
that's
babies.
like having one bombing of the US Embassy every 2 days.
Every 2 days.
And that Ufundi Plaza is populated with babies. And nobody seems to care.
And not only the babies, but the mothers as well. 7,950 mothers dying annually. Dr. Kihara, pregnancy is not a disease, as Dr. Victor has said there. So where does the problem lie then? What is the problem? What is going wrong?
I think I'll look at it in 3 ways. Women not being able to identify they have a problem and need help. That's the beginning. Then women actually getting access into a system that is functional. And then finally, getting the appropriate quality care that she requires at that time. I must state that we actually do know the causes that are killing our women. And they are essentially preventable, up to about 80%. But it is the health delivery system that seems to also be giving us gaps in the management of these ladies.
Let's talk to you on the way forward, Dr. Victor. The fact that there is monies now that are going to be given out probably across the country, and the fact that there's likely to be a scramble for these resources, and yet we're talking about devolution being the heart of the Constitution, really, meaning that only the persons that can access these services will be able to get them first, and then we're looking at a long-term plan where there's likely to be a health institution every 5 miles, according to the ruling coalition's manifesto. Your take on that?
Well, first of all, I want to say that if the Jubilee coalition looks at healthcare seriously, they can actually win the next election or within 3 years by investing in healthcare. The healthcare system is in such dark ages that a bit of light will really lift up the hearts of many people. And this cuts across all regions, not just the Jubilee strongholds, but also the opposition strongholds. Now, in terms of the way forward, we did work on an excellent document called the Musimi Task Force Report that has a clear plan over the next 3 to 7 years of how we can improve healthcare. I believe strongly that the same kind of healthcare that we give to the rich person's child at Nairobi Hospital must be the same kind of care, at least to some degree, that's available to the poor person's child. Is this achievable? Absolutely. One, we want to ensure that each and every county has a facility that they can go to that is fully equipped, has a dialysis center, has an ICU, and has medical personnel in an appropriate fashion. Secondly, allocate 15.94 billion every year for the procurement of all anti-HIV drugs, anti-TB drugs, the full essential drugs list, including all anti-cancer drugs, without a single cent from the mother, without a single cent from the donors. Then we have to ensure that our doctors stay in Kenya. In 2007, BBC wrote a report that Kenya had lost 51% of our doctors. The cost
Where are they going?
They are going to South Africa, Botswana, Rwanda, would you imagine, and DRC, and the Western countries. 51% of the doctors we trained. In 1999, we had 3,000 doctors. We trained 200 every year for 10 years. Then in 2011, we had 2,334 doctors in the public sector.
Dr. Kihara, your take on the same. NAS is already up in arms saying that they will now not be forced to take on even more than they already have. We have NAS's clinical officers having to deliver babies, and you know, this being, of course, overwhelming for them, seeing that they are already taking on so much.
I think that we also can't run away from the fact that we may need to engage domiciliary care, which would be basically provision at the community base, using the community health workers as a stopgap group. Because whether we like it or not, you have the institutional deliveries that are going on, but even as we talk domiciliary, it must still remain skilled. Such that if we're finding that we're having women that you're assuming would have a normal labor, but something goes wrong, then you have a referral network then into a health facility. But I agree.
If I may say something about the devolution process. Right now, healthcare as it is, handed over to the governors, is handing them a debilitating liability. It's a big financial burden that the counties cannot afford.
And the integrity of the persons that will be handling these monies should also be in check. Are they persons of integrity? Are they persons that will now start selling cotton wool medicine to, you know, the constituents?
In fact, one of the things that we're going to be proposing is that we enhance legislation against corruption of any kind in the health sector, because I think that can be equated to murder, because by withholding some form of funds that should go to healthcare, we're causing people's deaths.
Maybe I can add on. The community should actually hold those in office to account. And I think this is a perfect opportunity. For so long, we have actually been on the receiving end within the community. But now they can say, let's take stock. What is happening within our health facilities where we actually are based? I think that will make a difference.
So from what I'm getting from you, lady and gentlemen, is that this is a tick for the ruling coalition, but indeed a lot needs to be looked into if it will be feasible in the long run.
May I put in one word?
To achieve this.
To make this work, we need to start from the appointments to the secretary. Let it not be a reward to a political crony. Let it be a professional who can bring a difference. That is crucial. And
I will say very clearly, Kenyans need to take stock. This is our society today and tomorrow. We need to take charge of it. And
at the end of the day, of course, we need to see a reduction in the rates of mothers that are dying delivering babies and the babies that are dying at delivery.
And the quality, of the
healthcare.
person that is left behind.
Absolutely. Thank you so much, Dr. Kihara, Dr. Victor. Thank you so much for your time in studio. Of course, a lot of messages already coming in. It is a wide topic, and we hope that we will get time to bring you back in studio in future to discuss this development. Thank you very much for your time. We've got lots more lined up for you on Citizen Weekend. Kindly keep your messages coming. We will sample them as Citizen Weekend continues. Let's take a break now, but when we come back, let's take a look.